Thank you again for the invitation. It's a great honor for me to present here in front of you. Thank you to the whole audience, and I hope that my presentation will be very interesting for you with a lot of information and with many inputs about suicide prevention in the workplace, alliance of employees, managers, and employees. Today I will talk about facts. Facts are always very important, not to talk about I think, to have real facts. Afterwards, I will present about aspects of suicide prevention and alliances, and I will present, this is a little bit unusual, a poem. But from my perspective, a very important poem in that context. And clear at the end, I will present my conclusion. Like you have heard during the morning session, approximately 15% of working age adults have a mental disorder. Mental disorders can have effects on suicides. Work or working conditions contribute to 10% to 13% of suicide deaths. People who take their own lives are not necessarily mental ill. This is very important, but quite often depressed, very exhausted, and increasingly constricted in their perceptions, feelings, thoughts, and behavior. Consequent to the pioneering work of Durkheim and Freud, we have seen him also during the morning session, theoreticians have attempted to explain the biological, social, and psychological nature of suicide. Durkheim summarizes, suicide is the term applied to any case of death resulting directly or indirectly from a positive or negative act carried out by the victim himself, which she was aware would produce this result. I know this sentence is very difficult, also difficult to reflect and to accept. But this was Durkheim. Key facts from the World Health Organization, more or less brand new, 2005. Decent work, whatever it is good for mental health. Poor working environments, including discrimination and inequality, excessive workloads, like we have heard before, low job control and job insecurity pose a risk to mental health. Again, 15% of working age adults were estimated to have a mental disorder in 2019. I can add here, nothing has changed so far. Also, this data was presented from 2019. So 15% of working age adults have a mental disorder. Globally, an estimated 12 billion working days are lost every year to depression, and like you can see, to anxiety, at a cost of 3 million, whatever, per year in lost productivity. There are effective actions to prevent mental health risk at work, protect and promote mental health at work, and support workers with mental health conditions, like we have heard a few minutes ago in the last presentation. This is very important, what I will present now, and also this group around my colleagues, with the name La Montagne, Abbott, Blomqvist, and others. And this is a brand new publication, like you can see, from 24. Previously published analysis of suicide case investigations suggest that work or working conditions contribute to 10 to 13% of suicide deaths. This is a very high rate. A few years ago, I've published with my colleagues, I love it to publish books with colleagues from all over about burnout. Burnout for experts, you see it, in the context of prevention, in the context of living and working. And from my perspective, it is equal. If you decide to explore and burn out with a 12-stage burnout circle or with a 5-stage examination of burnout, 4 stages, there is another examination tool, or the examination with 3 stages of burnout. At the end, you will find always that a burnout does not come quickly. And to implement this information means also that we as professionals have time. So from my side and from the side of my colleagues in the book, this is a great chance. We have time to do it. We have time to support our clients, our patients in that field. So, you are familiar with the European Commission, I think so, and they have published in 2014 a booklet about promoting mental health in the workplace. And you see causes, for example, are genetics, previous life experiences, life events, traumatic incidents, and so on. And the effects for the individuals are, for example, or can be a burnout or a depression. If we go more to the right side, to the workplace side, and you see here the causes, well, there can be poor communications, violence, poor work organization, and other factors. And this can come to the effects, for example, of reputation and other reductions. So you have not to create a new wheel. If you like to check information related to promoting mental health in the workplace, we in Europe have this guidance, and we have the possibility, and we had the possibility to use it quite often. You can find it without any problem online. The World Health Organization published in 2014 about risks to mental health at work. I listed here a few ones. So risks to mental health at work can include underuse of skills or being underskilled for work, both very important topics. Excessive workloads, this is more or less clear for us. Long, unsocial and or inflexible hours. Very important also, lack of control over job design or workload. If you don't decide and somebody else decides for you, this can be a risk factor. I step forward. Unsafe or poor physical working conditions. I think this is clear for all of us here. Organizational culture that enables negative behaviors. Very, very important. Very often documented in scientific results. Limited support from colleagues and others. also clear, I think, for us professionals. Violence and other components, discrimination, exclusion, unclear job role, very important. If the role is not clear, it is a huge risk factor. Under or over promotion, job insecurity, we have heard about it in the last presentation. Also a very important point, inadequate pay. So the finances are very important in that context, how you feel. Conflicting home, working, or work demands. So you see there is an interrelationship between a lot of components. What can be done? The World Health Organization underlined in 24, well, governments, employers, the organizations which represent workers and employees and other stakeholders, very important, responsible for workers' health and safety can help to improve mental health at work through actions. For example, to prevent work-related mental health conditions by preventing the risks to mental health at work. Protect and promote mental health at work. Support workers with mental health conditions to participate and thrive in work, and create an enabling environment for change. Change is very important, that you have an option to change something. You see in the last sentence, 2 words, meaningful involvement. Meaningful means that the workers have the feeling that they are involved. Meaningful involved. The perspectives in that context are very, very important and very well scientifically documented. Yes, we have also not to create a new wheel regarding guidelines on mental health at work. So this was also shown a few seconds ago, published by the World Health Organization in 22. And I would also underline the recommendations for organizational interventions. Like you can see, we have here the universal organizational interventions, also related to health and emergency workers, for example, and for workers with mental health condition. And you have also not created a new wheel regarding recommendations for trainings. Yeah, you will find in that booklet training for workers in mental health, literacy and awareness. But also here you can find a lot of input related to emergency workers in mental health. This slide is very important for me. Like you have heard before, I'm working in the field since 40 years. And I've worked over 20 years directly with patients. To know the science, to be familiar with the science is so important. And I think that we have to train it again and again and again. Also after 40 years in that field, I would not say I have not to train it again. It's necessary that also people like me train, be open, and are very well educated in the fields of science. Science are, for example, when people are talking about that they wanted to die, that they have a create guilt or shame. Being a burden to others, you can feel how heavy it is, along this sentence, to be a burden for others. That the people have feelings, to be empty, hopeless, trapped, or having no reason to live, extremely sad, more anxious, very often, agitated, or full of rage, and so on. But also changing behavior, making a plan or researching ways to die with more and more concrete details. It can be very dangerous. Withdrawing from friends, saying goodbye, giving away important items. These are important signals. Taking dangerous risks, for example, as driving extremely fast, displaying extreme mood swings, up and down, up and down. And it's not the highest point or the lowest point, it's the way in between, which is so dangerous. Eating or sleeping more or less. Please be aware. If you ask your clients and patients, how do you sleep? And you will receive data about this night, 3 hours. The night before, 12 hours. Be careful. Reflect together with your patient and with your client. How is your sleep? Using drugs or alcohol more often. I step forward and I come now to the occupational groups. Very often my students ask me, okay, Professor Bährer, can you tell me more about the occupational groups? And I decided to bring for today 3 studies to illustrate how, or which I say to my students. My answers are always similar and always in the direction of very diverse professional groups are there. There is not a single occupational group. For example, this is a publication in the journal Health, Pharma and Medtech. And you see there are different, very different occupational groups. Musicians, singers, carpenters, roofers, and so on. And the highest rate is here 138.7 per 100,000 population. But if you compare all the occupational groups there, also with 68.5 at the end, related to automotive, body and relative repairers, we have to say very diverse professional groups. The Monash University published a very interesting scientific article about that. And I decided to bring here today one sentence. Concerning rates of suicide are prevalent in farmers, construction workers, ambulance and fire services, veterinarians, entertainers, artists, and the transport industry. So a broad range. As well as in female doctors and male nurses. So we have to conclude again, very diverse professional groups. A last presentation in that context. You will find it in the BMC Public Health Journal, and it's a very famous scientific presentation from my colleague Nienberg and her colleagues, about occupational groups and risk of suicidal behavior in men, a Swedish national cohort study during 2002 to 2019. And on the right side, you can see, again, a lot of occupational groups. And this population-based cohort study was of male, was done with more than 1,500,000 participants. And one important conclusion there is men with elementary occupations as well as personal care and building and manufacturing workers were at greatest risk. So now you are all familiar with the main result, very diverse professional groups. There is not a single occupational group. Please don't forget it. So important. I come now to the topic suicide prevention and alliances. An alliance can be a relationship among people, groups, or states that have joined together for mutual benefit or to achieve some common purpose. Commitments are at the forefront. This is, for me, always important, also when I give my lectures at university, to have such a definition, so that we have the same knowledge for my presentation now. This is what I think is an alliance. And there are necessities. I will start with employees. You see quite often in scientific analysis that employees have to take self-care, awareness about their workload, that they have to reflect about time management, setting of limits, reflection and talk about feelings, mindfulness of activity levels. And you are familiar with the sentence, eat well, sleep well. That's the task, do this. Management of relationships, ask for help. Mental health promotion, do it, and accept suicide prevention. A lot of work for employees to do. Ireland is currently very active in that field and has published on the right side this wonderful new figure in 25 benefits. So they will get benefits of positive mental health and well-being. You're all familiar that it can mean better physical health, including reduced risk of heart disease and stroke, enjoying life more fulfilling relationships, better quality of life, and increased longevity, better able to cope with challenges, feeling more confident and positive, and so on. So a lot of components if an employee implement this self-reflection. These are the benefits. My colleagues around David Bährer and Kathleen Pike have published in 2005 in that context, and they have written numerous guidance documents for employers. For example, the ISO, the first international standard on psychological health and safety at work, have emerged in recent years, but without conducting their own needs and risk assessments and evaluating the policies and practices they have in places, in their own companies, in their own institutions. Employees are left unaware of specific risks their workers face. I think this is very impressive. effectiveness of current practices and actions they could take that would have the greatest positive impact. And they analyzed even with the costs of mental health benefits and care are not subsidized by an employer. The indirect costs of poor mental health can be sizable in terms of, and you see it, for example, disability. And I would like to introduce you to the 3PS framework of my friends. So they said clearly: provide, promote, protect when you are an employer. Provide means provision to access to information, resources, and services that enable corrective organizational actions to address workforce mental health needs regardless to their cause. It means to promote, and promotion means the promotion of psychological well-being by developing the positive aspects of work as well as workers' strengths and positive capacities. To protect means protection of mental health by eliminating psychosocial hazards and minimizing risks that can negatively affect workers. Good. I conclude, in my own words, a few general aspects. So, employees and managers shall be aware, shall have an awareness about mental health and suicides at work, shall have the knowledge about mental health and suicides at work, and for me very important, an engagement, far away from finances and benefits, with, for example, appreciation, a good communication, reflective work assignments, adapted tasks, flexible working hours, employee involvement, preventing stigmatization. A lot of these factors are very well known, clear, and this is good. But also here you have not to create a new wheel. The World Health Organization, you can see I quite often work with that institution in Geneva, has published a booklet about preventing suicide at work, an information booklet for employers, managers, and employees, which you can find under this website here very easily. And yeah, it's, for me, again and again, very helpful. To provide, said the World Health Organization, to provide information sessions, training sessions for the staff managers on mental health and suicide prevention. This is a huge task to ensure all staff know what resources are available for support both within the organization and in the local community. To identify and reduce work-related stressors and factors which can negatively impact mental health. So simple and sometimes so quite often forgotten. So this is a brand new publication from Ireland. Again, you see Ireland is very, very active in that field currently, about suicide prevention in the workplace, a guide for employees. And this was published by the National Office for Suicide Prevention in Ireland. So they have documented 5 key action areas for workplaces. On the top, reduce stigma and encourage help seeking. To allow that it is normal to ask for support and help. To identify and respond to suicide. Restrict the access to means of suicide where appropriate. Increase awareness of available supports implement a workplace suicide prevention policy. This is so quite often missing. Also in the countries where I'm working and countries where I'm very familiar with. I promised at the beginning that I would like to show you a poem. We have heard yesterday, by the way, here at the Congress, about the German psychiatrist Erwin Ringel. He published in 1984 the following poem: alliances are needed between employees, managers, and employees to avoid decisions like, my thinking grows ever narrower, my vision ever blinder, and every day I'm filled more and more with my terrible fate. Powerless, I drag myself through life, deprived of all joy, with no one who knows and believes the extent of my misery. And then, very important, but my death will prove to you that for years and years I walked on the edge of the grave until it suddenly swallowed me up. My conclusion for today: suicide prevention in the workplace is possible. I've not written here 100%. Sometimes, you know that better than me, it can be very, very difficult. But in general, it is possible. So all of us, and I hope so, we can be very engaged in that field, and we can support and help our clients in the best way we can do it. Suicide prevention in the workplace needs alliances with employers, managers, and employees, and of course, others like family members. Families are changing in their structures. You know that. And for example, in Germany, we have lectures about family structures which have changed during the last 80 years in Germany. So we have not a single family model anymore. So we have more than 100 models published, by the way, by the German government. And this is, for me, in this context, very important. Family members can be many members. It's a huge, or can be a huge system, but it can also be a very, very small system. Please don't forget it. Suicidality is a complex phenomenon. I can't stand here and tell you it's very simple. And we have everything solved in that field. It's too complex. But this presentation here is also a chance for me to underline very important issues. Thank you very much. And it's not only a sentence here. If you have any requests, please contact me. You have now my email address. Yeah. It would be an honor to answer to your requests. Thank you very much again, and all the best for you and Taiwan.